two-part correspondence about schistosomiasis. Schistosomiasis is caused by a living flatworm of the genus Schistosoma. It is also known as bilharzia or snail fever. In Eastern Asia, it is known as a rite of passage for a young man to overcome schistosomiasis. The symptoms are usually an enlarged stomach, small pimple-like bumps, abdominal pain, fever, fatigue, and hepatosplenomegaly, the enlargement of liver and spleen. Some cases can be pretty severe. This is a magnified image of the schistosoma egg. The life cycle of the schistosomiasis worm starts at the egg stage. When an infected person urinates or defecates in fresh water, the eggs are able to float around until a certain species of water-dwelling snail takes the eggs in. From there, the eggs will develop into juvenile worms. By then, they will have to leave the snail's shell and float into the water to find a host. Once the worm enters your body, it will travel around. If it makes its way to your heart, it can be fatal. Like these worms, the juvenile worms will mate and have more babies. And by the time you start getting symptoms, you will be infested by thousands of schistosomiasis worms. The worms can be removed. Schistosomiasis is readily treated using a single oral dose of the drug praziquantel. While praziquantel is a safe and highly effective drug in curing an infected patient, it does not prevent the reinfection by schistosomiasis and is thus not an optimum treatment for people living in endemic areas. However, you can prevent schistosomiasis, and if you do avoid swimming, bathing, or wading in freshwater areas of Africa, Asia, and Indonesia, you will have a very low chance of getting schistosomiasis. If you cannot avoid these areas, when you talk to your healthcare provider, tell them you have been exposed to schistosomiasis. From there, your doctor will give you a prescription for a drug that will safely treat your symptoms. Today we will be talking about schistosomiasis.
What is schistosomiasis?
Well, schistosomiasis, also known as bilharzia, is a disease caused by parasitic worms. Although schistosomiasis is not found in the United States, 200 million people are infected worldwide.
How can I get schistosomiasis?
The infection occurs when your skin comes in contact with contaminated fresh water, and certain types of snails carry schistosomes are living. Fresh water becomes contaminated by schistosoma eggs when infected people urinate or defecate in the water. The eggs hatch, and if certain types of snails are present in the water, the parasites grow and develop inside the snails. The parasite leaves the snail and enters the water, where it can survive for about 48 hours. Schistosoma parasites can penetrate the skin of the persons who are wading, swimming, bathing, or washing in the contaminated water. Within several weeks, worms grow inside the blood vessels of the body and produce eggs. Some of these eggs travel to the bladder or intestines and are passed into the urine or stool.
What are the symptoms of schistosomiasis?
Within days after becoming infected, you may develop a rash or itchy skin, fever, chills, and cough, and muscle aches. Can begin within 1 to 2 months of infection. Most people have no symptoms at this early phase of infection. Eggs begin to travel to the liver or pass into the intestine or bladder. Rarely, eggs are found in the brain or spinal cord and can cause seizures, paralysis, or spinal cord inflammation. For people who are repeatedly infected for many years, the parasite can damage the liver, intestines, lungs, and bladder. Symptoms of schistosomiasis are caused by the body's reaction to the eggs produced by worms, not by the worms themselves.
What should I do if I have schistosomiasis?
See your healthcare provider. If you have traveled to countries where schistosomiasis is found and had contact with fresh
Hello, my name is Lindsay Proctor, and we are live from the house. My partner, Teresa St. Pierre, just got diagnosed with schistosomiasis with us.
Am I at risk?
Live in or travel to areas where schistosomiasis occurs and your skin comes to contact with fresh water from canals, rivers, streams, or lakes, you are at risk of getting schistosomiasis.
In what areas of the world does schistosomiasis occur?
Right here in Laos, Iraq, Saudi Arabia, southern China, third world countries, pretty much.
How can I prevent it?
You can prevent schistosomiasis by avoiding swimming or wading in fresh water. When you are in countries in which schistosomiasis occurs, swimming in oceans and in chlorinated swimming pools is generally thought to be safe. Drink safe water because there is no way to make sure that your water is coming directly from canals, lakes, or rivers. We asked Elizabeth